We were looking for something that took advantage of the synergies between the School of Medicine and IU Health. The leaders of both organizations came up with an idea for this particular institute, and Deborah and I were instantly enamored by that suggestion.
I think it's humbling to be part of such a big effort, world-class healthcare and great education. It was a no-brainer for us.
I said to Deborah, I think we ought to approach John and Sarah and see if they have any interest.
And I can say he sort of had me at hello. My relationship with IU Health is very personal. I had open heart surgery here, and IU Health saved my life.
When this was proposed to us, it took seconds for us to sign on. There was no question.
While there are other many worthy causes, some of which we support, this one has the potential to have the greatest impact.
It's almost impossible to quantify the impact because this will live beyond all of us.
Through this gift for generations, we know that more and more people are going to have access to some of the most cutting-edge research, and that's going to change lives that we can't even imagine.
There are many small clinical trials looking at specific features of new, maybe medicines or new drugs or new devices, and then there are larger ones. So many of the solutions we have today, we got from clinical research.
I can't imagine an academic health system and a school of medicine that are better positioned to be leaders in clinical trials. For patients here in Indiana, it could be the opportunity to receive life-saving therapy that you wouldn't be able to get elsewhere.
Our vision is to be the best. If there's an innovative therapy or a pharmaceutical company is in a stage 4 clinical trial, they say, hey, IU Health, the School of Medicine, that's where we want to do that clinical trial.
There are very few who would have all that IU has in this facility. The facilities, the talented people, the capabilities, the patients, the ability to get people in, get them studied, is a tremendous asset.
We have been leaders in medicine for a long time, and we're very intent on continuing to make innovations in the future that make a difference in people's lives.
This opportunity was almost meant for the four of us.
Through this connection and through this investment that we're making to leave behind a legacy that hopefully will advance medicine.
John and Sarah, Deb and Randy, thank you all so much for what you are doing, not only now, but for what I know will transform health in our communities.
I don't think I can begin to say thank you enough for both the Lechleiters and the Tobiases, new treatments and new cures for not just the people of Indiana, not the United States, but the whole world.